one of the things that I admire about you among so many things, and your story in itself is so inspirational, and is that you're a great communicator, you're a great storyteller, and you know that not only reveals itself in the books that you've written in the Ash Kane series, but in terms of how you make complex situations and concerns so easy to people. Tell me about that, and how did you develop that skill? Where did that come from?
Well, first of all, I love story. And I've always loved story, which is why I now write fiction and I write a murder mystery PI series, the Ash Kane series. And I really see the world and my interactions as scenes. And that's just kind of how I see the world. And everything and everyone has a story to it. Whether I was just writing, I'm writing right now, and believe it or not, I'm writing a memoir I'm in the middle of about my first year as a surgical intern. But I'm telling you this to say I'm in the middle of writing this memoir of my first year as a surgical intern, and it's all about story. And I'm writing a chapter on a night in the trauma center at a South Bronx ER. And the patient comes in, young guy, 25 years old, thin, multiple gunshot wounds, gang-related violence. And I talk about how after the patient unfortunately dies, how his head turns and I see a small tattoo on the back of his neck. And I'm locked into that tattoo because I'm now thinking about what's the story of that tattoo? Now his life is gone, but that tattoo is still here. So what I'm saying to you is that I see story in everything. But what I also noticed was that a lot of these patients did not understand the doctors. They didn't understand the esoteric medical language that the doctors use. There was just, you talk about pure cultural dissonance and disconnect. And that's what I saw as a young medical student. And I realized that equally important to me learning about medicine, learning how to make a diagnosis, learning how to draw blood and treat, equally important was me being able to talk to these patients so that they understood what was going on with them and to them, to empower them with the knowledge that we as the medical staff had